Hi, my name is Dr. Wellens, and I'm here to talk to you about swelling in your ankles and your feet. Unfortunately, I see a lot of patients, especially elderly patients, who do not properly seek care for swelling in the ankles. They just think that it's something that is normal with age, and unfortunately, sometimes assumption of things does not help it, because I have seen many examples of deep venous thrombosis, which is also known as blood clot, which is a life-threatening condition where patients had swelling in their legs for a long time and it went misdiagnosed. They didn't properly mention it to their primary care physician, and it is a medical emergency, and you can actually die from a blood clot when it travels to your lungs and causes pulmonary emboli, which is definitely life-threatening and requires immediate hospitalization. The beautiful thing about modern medicine is that it improves all the time, and we do know that if you properly diagnose and treat deep venous thrombosis, which is also called blood clots in the legs, a lot of the times that can be now treated on the outpatient basis, and you don't necessarily have to be immobilized. But as you probably know from all my previous messages and videos, it is very important to diagnose it on early stages. Therefore, if you have swelling in the ankles, please don't automatically assume it's because you drank too much water, or because you're tired, or because you gained a little bit of weight. It can be much more serious than just a simple, at-home Google diagnosis. You need to see a physician, you need to have proper testing done, you need to have proper diagnosis in order to treat it in a timely fashion. What are the other possibilities if it's not a blood clot? It can be an inflammation of a nerve called Morton's neuroma, and we see a lot of swelling with this condition. Also, a lot of my elderly patients, sometimes if you have osteoarthritis or rheumatoid arthritis or even gout. But again, because swelling is such a common reaction to body's inflammation, just don't ignore it, because it doesn't necessarily mean you just have bad veins. It can be something else going on. And for example, in my clinic, we have an excellent diagnostic tool that tests your circulation right here on the spot. And we basically know within minutes whether it's a medical emergency or something that can be referred out, or you need an MRI. But again, please don't just use Dr. Google. Seek a medical professional, get accurate diagnosis so you can be properly treated.